the numbers. So these are the cases, and that's the age distribution that you saw, that for the average age being 58. And that's true for the cases. But look at the death. The death, okay, you have 10%, 55 to 64, 24% between 65 and 74, 30%, your highest one, up to age 84, and then 85 and plus, almost the same amount, 28%. So if you do that math, that's 2, carry a 1, 3, 6, 8, 90% are in this age group. That's the danger zone. And why? Because these people have comorbidity. Obesity plays a huge role. You know, if obesity comes diabetes, hypertension, cancer, everything else that takes you down. So we have to get a message out there that it's the culprit is our comorbidities, and our comorbidities, almost 75% of them have to do with obesity. So that's something that we're going to have to be able to put into our community planning and our community efforts as we go forward.
Andrew has a question. How closely does the reopening strategy align with the state lab plan? And is there coordination?
Our three major counties, Palm Beach, Broward, and Miami, have, and Monroe also, although they obviously play a less role, but they're very involved in this. We have one united message. We've been meeting together, planning together. Their mayor in Miami did announce that they were going into the phase 1. They're calling it phase 1, the same as the governor and the president. We're using different phases in Palm Beach County. Nothing to do with the governor, nothing to do with the president. But yes, we're united in that, but we're not going to do anything until our numbers say that we can do it. So if it means breaking apart from them, we will, but we have to have the data to support going forward. We're very close to that, but we just have to verify, make sure that we have all our ducks in a row, and we have to make sure that the public will continue to do the social distancing. Here's a little bit of the race and ethnicity as well as the hospitalizations. Again, you see that the big numbers, 69% are non-Hispanics, white non-Hispanics, okay? And that's what shows you here. The white is 66%. So even though in this first case, in terms of cases, we have this big unknown, and I'm sure that the more we test, the more we will see more Black, this unknown race. There's got to be at least percentage of the population. The Black is 18% of the population. So if you take 18% of this and you break it up, these numbers will go up for the Black and the Hispanics. But the big number here is the white non-Hispanic, okay, which makes up 46% of the deaths and 18% for white Hispanics. These are the two big numbers. Then you go to the Black with 22%. That's another big number. And again, non-Hispanics is for the Blacks, only 1%. It's only 6 cases for Black Hispanics. And then you get the others is only 6%. So if you take this other and this unknown and you add it to these numbers, you still see that the big number is right here, this 46%. Maybe we're close because the Black is 18% of the population. So if it's at 22, it will have a higher impact to the Black community than to the others, but it definitely doesn't look like Louisiana or Detroit or some of those other really high where it's triple or quadruple the amount. So we'll keep testing that because we still don't know, and we'd like to have more data. So we want to do more testing and continue to do testing in the Black and Hispanic areas that we know we have people in there. The testing sites, these are all the sites. I think you're familiar with all of them, except perhaps the the Lakeside Medical Center, which has now has not only the walk-up, but also the drive-through. And it's by appointments only now. It used to be just walk up, but now that they put the drive-through, which started yesterday, they're seeing quite a few people. The distribution is from Pahokee all the way to South Bay and some surrounding counties that also have come in, like Henry. So they're doing pretty good. The first day they filled all their appointments, and the second day they have even more people available. South County, the clinics have also started picking up a little bit since they relaxed their criteria. Now they're taking 16 and older with concern. So they're really not doing the symptoms, but just concern. So they're testing about 250 per day, as opposed to the 15 that's doing sometimes over the 500 per day. And so these are the two outreaches that we have going on. The West Palm Beach with Found Care and supported by the city of West Palm Beach and Quantum. And then we have the Boynton Beach outreach. They're not quite up and running yet, but that's being supported by Genesis and perhaps the Bethesda Hospital. That's still being finalized. They don't really have it all set up. And then the one that I talked about being done with the fire rescue, the county fire rescue. All right, so I'll leave that for the school then. Any more questions? No.
Any other questions for Dr. Alonso before, because she may not be able to stay for the entire presentation. So you have to get your questions in early. They're having a hurricane meeting right now.
And they're calling for me.
All right, looks like we're okay. So thank you, Dr. Alonso. Really, really appreciate it. Deirdre says she appreciates your leadership as well. We all do. I mean, like I said before, we're very lucky to have you here in Palm Beach County.
I feel lucky to have all of you. So, feelings mutual. Thank you.
Thank you. All right. So I know, June, I saw you on. I'll look for Paul, but maybe we can have yourself and you can begin by just talking a little bit about the school district and where you guys are in terms of getting everyone set up, scheduled, some of the challenges, some ways that we might be able to assist. And if Paul is on, I'll have Doris to look to see if he logged on as a panelist. If he's not on, then June, maybe you can say a few words about the online portal. We were hoping to have him demo that.
Sure, I'll cover that after. Can everyone hear me?
Yes, we can hear you.
Okay, well, thank you first of all for giving me an opportunity to share what we're presently doing in the school district as it relates to supporting our students' mental well-being during this unprecedented time. I will cover a few of the initiatives that are presently in place, that are in place when we're brick and mortar, and that are still in place during our virtual time. And then I'm open to questions. I saw there was one question during Dr. Alonso's conversation relating back to school centers. So I'll get to that after. But just to review a little bit, our mission at the school district is to meet the behavioral and mental health needs of our students. We have a mental health plan that we have to write each year in accordance with 2 Senate bills that came out 2 years ago, Senate Bill 7026 and 7030. And what's in those mental health plans is how are we going to help with the student access to mental health supports. So I just want to cover a couple of those initiatives. The first one is our school-based health professionals. Thanks to the voters here in Palm Beach County, we have one of these individuals, a school-based health professional, on each of our campuses. They're mental health professionals, and they are, like everyone else, trying to navigate the virtual world, but they have set up some different opportunities to support our students in different modes. These can include, it's going to vary from campus to campus, but they include right now virtual small group meetings, remote check-ins with individual students, and many of our behavioral health professionals have created their own Google Classrooms, and they're inviting their students into the classrooms for them to be able to offer them social and emotional learning lessons that we've provided, as well as lessons that they're creating themselves. The second initiative is the co-located therapists. In this county, we are very fortunate to have partnerships with our community agencies. Through these partnerships with 11 of our agencies, we're able to provide 100 of these licensed mental health professionals on campuses throughout our counties. Through this initiative, our Palm Beach County school students are eligible to receive up to 12 free individual teletherapy sessions. And again, these are different than the school-based health professionals. These are licensed mental health professionals or registered interns. And then the third initiative that we have in place that I just want to touch on is our CAPE teams. In brick and mortar and normal circumstances, these are the folks who would manage our mobile crisis teams. When there's a student in crisis on a campus, they will deploy out, offer assistance to that student, and do wraparound services. We are continuing to offer those services. Of course, now it's through a mobile hotline, and then we're able to connect services to those individual students. But through that, we realized that we needed to open up a mental health helpline for our parents. That's open Monday through Friday from 8 to 4:30. The phone number for that, which has been publicized in a number of different documents, is 561-434-8250. Again, we encourage still the use of our community resource 211, but we knew that there were some parents that were reaching out for questions that weren't necessarily, 211 level, so we wanted to open up this helpline. Again, our work is going to be focused on ensuring that our students have access to the mental health supports they might need. And those are the initiatives right now. James, you asked what kind of support. We just really need the word to get out to families that there's support out there, if their student is struggling, and that we have resources that we can deploy out to them.
Okay. Thank you very much, June. Really appreciate it. And we'll continue to support for all of us that are serving families, especially families with kids. There are specific things that we can do. We can make sure that those kids, they have their computers. We can make sure that they have internet access. We can make sure they have their supports, their whether utility supports or housing supports. All of those things help support their learning, mental health, behavioral health supports. And so we'll continue to refine our strategy to support the families within the district throughout the remainder of this year and as we move into next year. And so if we have some time towards the end, I don't know if Tammy is on the call, but I know that there's going to be some updates related to summer feeding programs, and maybe Julie Creeper will be able to share that if we have time. But for now, we're going to turn it over to Paul. I'm going to ask Doris to give Paul presenter rights if he's able to walk us through the distance learning. I think that will be phenomenal. This is a portal that has recently been developed by the district that I think is going to really help in terms of being able to identify areas that need more assistance, and maybe then we can collectively kind of target our efforts towards supporting those schools that need help. So Paul, I don't know if you're able to gain presenter rights and to demo that system, but if so, then you can take it away.
Yes, sir, I can. Thank you. And I appreciate y'all having me on today. I believe this is going to show everybody my screen. Is everybody able to see the PBC distance learning?
Yes, we can see it.
Logo kind of at the top there. All right. So again, James, thank you for having us today to talk through this. We've been kind of, our teachers in our schools have been working frantically to, educate our students, and those of us in the research side of things have been working frantically to try to understand what we're actually getting out there in terms of content. So I appreciate y'all sharing time to let us show this. We've got the caveat here. Let me start with the caveat is, we know there are students receiving instruction in a lot of ways that we can't necessarily see from the district level lens. Students who are watching instruction on our streaming channels that we have with Comcast and over air, and then checking in with their teacher on a phone call. That information is really, that type of interaction exists at the school and teacher level, and we're working on ways to get better visibility into it. But at this time, we really, our best access is to see the students who are accessing our content through the district's student portal, which is the login screen most students see when they actually access the system. So that's the starting point of this. It's not a complete picture, but it's the most complete picture we have at the moment. So starting here in the upper left, you'll notice kind of a date range. This first set of data is really just to show longitudinal information over time. What does the daily access information look like over time? So you've got a slider here where you can pick ranges of time. I'm going to go and filter this just to last week, the full instructional week, so we can just kind of use that for context. So last week, April 13th through the 17th, this data represents how many of our students were accessing the district student portal each day over that week. To the left, you can see, you can look at it by students who have received district devices versus students who are using other devices. We can look at it by, the region, the school, the city the school is in. There's just several filters you can use to actually drill down to a specific subset of students if you want to know something about a specific group. Then moving across the top, we've got basically just the daily snapshot of the proportion of students in district-operated schools who accessed the portal that day. So just on the 13th, it was a little over 82%, and on the 17th, it was a little less than 78%. But again, one of the things we definitely want to make clear here, and it'll be a little bit more informative on the next tab of data, is we've got schools doing things in a lot of new and different ways. This isn't the traditional, I've got to be in one place for 6-7 hours a day to be marked present. This is more about engagement than presence, so to speak. So, but that's just kind of that daily snapshot of what that looks like over time. Then over here, it's which tiles in the portal were students accessing. We've limited it initially to some of our more used instructional tiles. This top line is Google Classroom, which is our primary delivery mechanism. And you can see, last week on each day of the week, ballpark figure 75-78% of students were accessing Google Classroom through the portal. This does give one of the credence to one of the caveats. So if you're accessing Google Classroom through your phone, unfortunately, we don't see that as a student. If you're accessing through a link and an email the teacher sent you, we're not seeing that either. This has to go through the district portal for us to see it. We're working on increasing that snapshot of visibility, but as of right now, as I said, this is what we have. And then here at the top, if you were interested in one of the specific tiles, if you had a school that you knew was using Achieve 3000, you can click on that. You can actually drill in and look at any of the tiles in our portal. So then the last piece, just to show you for some context, is these bottom charts show the same data, but these are the filterable data. So if I was interested in students in grades 3 to 5 and what they're doing, I could just click on that filter and it would adjust these bottom tables to show what that group of students is doing, and you still keep the district data at the top for a comparison. So on Friday, while district-wide, 78% of students were accessing the portal, students in 3 to 5 were accessing 82% of them accessed. So that's the longitudinal data. And I'll just stop to ask if there are any questions on the longitudinal piece before I move to the next. Okay. So this next tab is more of a snapshot drill in that allows you to kind of look at one day by itself or a span of time. So I'm going to pull this back to look like we did just before at last week's instruction. So the 13th through the 17th. Nearly 95% of the students in district operated schools accessed the district portal at least once last week. So, that's a really, really high number. We're really proud of that number. We're proud of our schools and our teachers for actually getting to that many students. And again, this doesn't necessarily account for that student who's watching TV and interacting with their teacher on the telephone. But, this gives us a count. So 165,000 plus students accessed the portal last week at least once. Represents a little less than 95% of our students, and 85% of those students hit Google Classroom. These are all really good indicators in terms of the metrics we're tracking, because those are our primary sources for instruction. And again, that filter across the bottom has stayed on. So grades 3 through 5, the numbers are a little bit higher than they were across the district as a whole. One of the other things we're really happy about is if you were to filter to the students with district devices, they're actually accessing content at a greater rate than the other students. So we're seeing a lot of value in the support we provided to the community in handing out devices for students to access content. And then just those are really the two most powerful, in my estimation, pieces of data we've got out. The rest is just kind of provides some context when you're looking by schools. So if you go to the third tab, and the navigation is here across the bottom. This provides that same data broken out by school. I'll just use Acreage Pines as an example because they're at the top of the list. So I'm going to clear the filter, so we're looking at the school as a whole. So Acreage Pines has 513 students enrolled. Based on the data we have, we provided 188 devices to those students, which means 325 are without a device, most of which probably working on their own devices or, again, reaching out via phone and television to get instruction. So a little more than a third of those students have a device provided by the district. And then when you continue across to the right, 98% of the students at Acreage Pines accessed the portal at least once last week. Of the students who had a district device, 100% accessed the portal at least once. And of the students without a district device, 97% accessed the portal. So that's just, again, a snapshot that you can look at schools, clumps of schools together. If you're looking at, really municipal levels of community support, you might have some value in bringing those schools together into one snapshot to look at to guide your conversations there. And then finally, the fourth tab is, again, usage data provided over time. You can, again, adjust these slicers to look by day over the entire span since we've been back from spring break to see what proportion of students were accessing the portal in any given day over that window. And then you can see what it looks like by district device or other devices. And the color gradient here is basically just relative performance, how this percentage looks relative to everybody else in the slice. So the darker the green, the higher the percentage relative to everybody else. The lower or the more yellowish orange, the lower that percentage is relative to everyone else. So looking at Barton,
are you able to sort? Are you able to sort by to see all of the schools where, like, that are in the yellow or the orange? Is there a way to sort to see that?
Not really. Not really a way to sort high to low. Hang on one second. In this particular field, unfortunately, but you could look by community to see where those lower numbers are. But one example of one of the places where we've got a lot of students learning in different ways, not necessarily through the portal. An example of that is Barton, where you can see the students who have the district devices are accessing at a pretty high rate. But we've got a lot of students who no internet at home. Maybe they have a device from the district, but they're still waiting for Comcast to get internet set up. So, we've got, still some struggles and some students who are learning in different ways that we can't capture, as I said. But the schools are really reaching out, and we've actually got it we're down to a very small proportion of students, school by school, that they're still trying to actually reach. So they actually have gotten to the vast majority of their school students. So in addition to this data that's actually publicly available, and James, I can send you if you don't have it, I can send you the link to this website. Each week we've been providing schools a roster of their students, whether or not they access the portal, daily over the span that we've been in place, and teacher attendance so that they can actually triangulate. So, for example, a student who hasn't accessed the portal at all and their teacher has marked them absent every day, those are obviously our highest priority students to get in contact with, and schools are working really hard to get to. That's it in a nutshell. I can take questions, or obviously I'm available via email later if need be.
Yeah, so you can, Paul, if you're able to just copy and paste the website link into the chat box, then everyone could have it. Connie is asking if it's available publicly. So I guess that's, she wants to know if we can actually access the system. And then I wanted to know, okay, and then I wanted to know.
I'm actually showing the public-facing version. Obviously, the version where we, the places where we're including rosters and whatnot, obviously that's school-specific, but just pop the link into the chat box, and that'll take you to it. And again, the navigation between panes is at the bottom and the middle, and then all of those filters would just work as you would expect them to.
And what is you have one of the sorting there by race and ethnicity. Can you talk about that a little bit?
So basically what we've done is we've taken our student usage data that we're getting from our IT department, because they track all of the traffic through our district portal. We're taking that and we're matching it to student demographics, student school of assignment. So these are just typically how we look at different breakdowns of the data. So just give an example, filtering to the African American students, on a daily basis, the rate's a little lower than everyone else, not everyone else, but the total. But let's move into the second one real quick and just take a look and see. When we look over the entire span of instruction since we've come back from spring break, if the filter will let me, bear with me 1 second. Don't know why it is doing that. I apologize, y'all. I'm not sure why that's acting up. I'm going to just refresh my screen real quick to see why it's. Okay, so looking at the data to say, who's accessed the system at any point over the entire span, and when we break that out, so basically, our African American students are accessing the district portal at the same rate as the district overall. When you look over the span, it may fluctuate from day to day. but you can basically break your filters by that. You can look at, students on free and reduced lunch. They're accessing it a little bit less than 98% of those students have accessed at any point over the span. English language learners, you can actually cut by grade level. I'm not sure why that's jumping around on me. Did that answer your question, James?
Yes, it did. It did. And everyone has the link at the bottom, so in the chat box, so you can, if you can't copy and paste it, then we'll send it out after this webinar is complete. Any questions for Paul before we move on to the next presenter? We really appreciate you and June taking the time to share some insights about what's going on. I mean, this is a massive undertaking to be able to transition an entire district to an online system. And I want to commend you guys for the work that you have done, and certainly want to be here to continue to support you and our students as we progress throughout the remainder of the school year.
Yeah, I appreciate that. I mean, it's definitely the heavy lift was, has been our schools and our teachers just getting in there and retooling very quickly.
Thank you, James. Thank you, everyone.
Thank you, guys. All right, let me see if I can start this and get back to our next presenter, which will be Takesha Miles. I did see someone who requested that we show the testing sites one more time. So for that individual who requested that, I'm placing the testing site on the screen, the sites on the screen. There for you. And then we're just going to progress forward and let Takesha take it from here. Takesha, are you on?
I am here. Thank you so much for the opportunity to speak, James. And so Legal Aid Society, in response to the COVID response, created a informational resource guide, which is actually on our website, and it actually is available on our website in one document. And also then we've broken it down through topics, through mortgage foreclosure issues, landlord tenant, consumer issues, education resources, and tax information, because we have a low-income tax clinic. We've also because we are closed to clients, but we are open virtually. We have our online intake program, so you can go on our website and access our online intake and apply for assistance or apply for a client who needs assistance. It will send an email to our staff, who will then make contact with the person to do an intake and get all the details we need to start looking at their case. I want to spend a few moments just kind of go over some of the big issues that we covered in the legal resource guide. The first one is the eviction moratorium. And so essentially what it does on a state level, Governor DeSantis suspended and told the eviction statute as it pertains to non-payment of rent cases for 45 days. Then locally, our chief judge for the 15th Judicial Circuit has suspended writ of possession from being issued until May 29th. So we have a nice window until May 29th where evictions cannot happen for non-payment of rent issues. And federally, under the Federal CARES Act, if the property has a mortgage backed by Fannie Mae, Freddie Mac, VA, USDA, then there's an additional 120 days, and that where eviction cannot happen. So it takes that deadline all the way to July 25th. The caveat is you have to know that your landlord has a property that has one of those mortgage products, which is hard to know. There are a number of, like the Schimberg Center, starting to build some databases so that you'll be able to search a property address to see if it is one of the covered properties. If it is one of the covered properties, then you have the big window until July 25th to not have an eviction filed. If it's not one of those covered properties, then you go based on either the state executive order or our local order that each circuit judge has put, each chief judge of a circuit has put into place. Like I said, Palm Beach County, no eviction writ of possessions for non-payment of rent until May 29th. The thing that the moratorium does not do are the following. It does not relieve the tenant of an obligation to pay rent. And I've seen a lot of things on social media that say, well, I have until May to not pay my rent. That is not true. Your obligation to pay rent has not been suspended. Just the opportunity for the landlord to file against you has been suspended. The rent will still be due, at the end of the moratorium. And I think that's where a lot of the clients that we are going to have trouble and being able to come up with the money at the end of the moratorium. It doesn't prevent a landlord from charging late fees. So if the person is not paying their rent for April and May, they still can be assessed late fees. It doesn't prevent a landlord from filing an eviction case for something other than non-payment of rent. So if there's a lease violation, or that if the tenant is alleged to have pose a threat to the health and safety and welfare of others, they can still be evicted. We've seen an uptick in a lot of landlords starting to start non-renew resident tenants, trying to get away from the eviction for non-payment of rent.
Keisha, I have a quick question for you. So if someone has received, first of all, can you clarify because I think on the executive order, it says 45 days and instead of 60. I'm not quite sure, but I thought I read 45 days would put us at the middle of May. So one, can you clarify that? And then two, I'm still seeing people who are receiving eviction notices and they're dated for like April 9th, 10th, which is after the governor's executive order. How should they proceed if that happens?
Okay, so going back to your first point is that the governor's order suspended and told evictions for 45 days. So that is the middle of May. But locally, our chief judge in her administrative order has suspended writ of possessions, which is the ultimate end of the eviction. So if you read those two orders together, no one can be put out of the property until May 29th, with her order being the last and the longest.
Gotcha. Thank you for clarifying that.
If you all hear people being served with evictions for non-payment rent, please get them to our office so that we can represent them and help them. The evictions that should be only going through should be for evictions for things other than non-payment of rent. Someone doing criminal activity on the property, someone maybe their lease ended and they're refusing to move out, and they was supposed to naturally end on a certain day, and they haven't moved out. They're what we call a holdover tenant. Things like that should be the only evictions that are going forward after the April 2nd date.
And then, legal aid was already overwhelmed with the number of eviction cases that were coming through before this pandemic. Do you have any plans for, say, the surge that is likely to occur once those 60 days have expired? How have you guys been discussing that? And if so, any strategies that you can share?
Right now, the only strategy I have right now is I have been trying to recruit law clerks. Naturally, summertime is the time that we have multiple law clerks here. And so I've been trying to recruit law clerks. I have one already guaranteed for the summer. So we're going to have to use a system of law clerks. I got a call from Temple Israel, who has a social action committee, who want to volunteer. So maybe, trying to, help train people to screen and triage some of the eviction calls for us. That is one other plan of action. But we are worried that on May 30th, there's going to be an onslaught of eviction cases filed and not have an avenue, and just it is going to be really scary, because that's one thing that's going to open the floodgates on. But we also have foreclosures that will also be starting to kind of get restarted at that point also.
Okay, well, if there are things that you think that we can do to assist, I'll have Wendy and the team reach out to you so that we can plan and kind of strategize around that. Looking at the new pot of dollars that we have, maybe it will require us to set up some type of relationship with the courts so that they'll have a go-to rather than to kick people out on the streets, because we can't have that.
Yeah. And I'm really worried because people, it's one time to miss 1 month, but now we're going to have probably April and May missed payments, and no one's going to have that money.
Yeah, I know.
Moving on to mortgage foreclosures, similar situation. The statute is told and suspended starting April 2nd from the governor's order. Our local judicial order gives us until May 29th on prohibiting foreclosure sales. So we don't expect any new mortgage foreclosure cases in this period. However, if the property under the CARES Act, if the property is backed by one of the federal agencies that back mortgages, then there's a little more window. So there's 120 days to prevent foreclosures, and that takes us all the way out to July 25th. And it provides also the CARES Act a right of forbearance for up to 12 months of forbearance for a resident. One of the key things that the mortgage foreclosure moratorium does not do, it does not relieve the homeowner of the obligation to pay the mortgage. And the scarier part is that the governor's order did not suspend HOA and condo foreclosure. So we are still getting people served with HOA and condo foreclosures for not paying their assessments and late fees. And so there's nothing that stops the condo associations from putting people out under those circumstances. So that I don't think anybody was thinking about that as an avenue of that there might be people losing their houses and condos for not paying HOA fees.
So people can get evicted for HOA fees, but not their mortgage?
Correct.
Oh my God. Okay.
And we're talking about, I have one of the last ones that we had that came in. She was served early April. She owed about $2,000 in late fees and assessments. However, with the attorney's fees and the interest, the settlement amount that they're looking for a payoff is almost $5,000. So what was a $2,000 debt with all the other fees that get tacked on is a $5,000 to resolve it to save her house that she's lived in for over 15 years. So that is something that was not contemplated, I don't think, on the federal, state, local level. But that is one area that is still moving forward. Moving to consumer issues, under the CARES Act, all three major credit bureaus are offering access to credit reports weekly on the annual report website, which is www.annualcreditreport.com. So we try to encourage consumers to continue to check on their.
You're going out, Takesha.
Sorry. Just encouraging people to check their credit reports through the CARES Act. All three major credit bureaus are offering access weekly to the credit reports on the annual credit report website. Most of the credit card companies are offering plans to help consumers who are having troubles paying their bills. So we're encouraging people to take advantage of that. Same with a lot of the big auto loan companies, also are encouraging people to contact them. Student loans, for most people, it's an automatic kind of grace period they're going to get. Just need to reach out to their loan servicer to ensure that they are getting that assistance. The one thing that I want to mention out that is a concern to us and that will be a concern to you all is that one thing with our stimulus checks that many of us have received and some are yet to receive, there's nothing in the CARES Act that prevents garnishment. And so if a client has a current garnishment case or a judgment that's ready for garnishment, they could have their stimulus checks seized by the bank and related to a garnishment order. We had that happen to a client a week ago, and her deposit went in, and then within minutes, it was taken by the bank in relation to a garnishment order. And so a lot of the legal aid programs, including our office, have written to the governor to request that the governor do an executive order to prohibit creditors from garnishing bank accounts for stimulus checks, to ask that the governor essentially say that a stimulus check, since it doesn't have to be repaid, is like a public benefit, like Social Security benefits, retirement benefits, pension, that are currently protected from garnishment. So we are trying to advocate for that, that the governor sign something, put something in effect that will at least protect people's stimulus checks, so that they have it. Our client, they took all the money and left her $60. And so to go from, to have that expectation that you're getting this chunk of money and to lose it is devastating. And just, okay. Some of the other projects that people might need our assistance are domestic violence projects. We represent clients who are in need of a restraining order or an injunction to prevent abuse. Our education advocacy project, if any of our students who have disabilities need any kind of advocacy, either IEP or 504 plan during the remote learning period. Our low-income tax payers clinic can help people who have tax controversies they owe the IRS. We will help them try to navigate through the IRS system. We have an elder law project for anyone over 60 who needs assistance. For example, there are things that are happening in the buildings downtown, St. Andrews and St. James, which is a predominantly over 60 building. They stopped delivering packages from USPS. So no United States Post Office packages were allowed to come through. And so we got feedback from a lot of the residents saying that a lot of them get their medicine through the mail. And so by the management company stopping the delivery of their packages, they weren't getting access to the mail. And their solution from the management company side was that you can go down to Clematis Street and open up a P.O. box. Well, for people who are in their 70s and 80s, that is not a solution for them. So we're doing some advocacy to try to help them get access to their packages. We have a veterans advocacy project for veterans over 60, and then our fair housing project investigates discrimination claims. We have webinars that we put on Facebook that will be coming up from everything from landlord-tenant rights to fair housing, helping consumers and small business owners. And so over the next 2 weeks, starting on Monday, we're offering free webinars at 6 o'clock to the general public or partners who have questions about specific topics, or we'll for an hour go into those topics and try to make sure everyone understands what their rights are and their responsibilities are under the law.
Thank you. Thank you so very much, Takesha. A lot of useful information there. And again, this webinar is recorded, so we'll make sure that you go to the Community Services website in order to review it. We have about 15 minutes, and I definitely want to hear from CareerSource, and if Elisa, DF, and Julie Crefo have some updates that they'd like to give, I'd love to hear from them as well. So I'm going to turn it over to Julia so that she can give us kind of an update on what's happening with the unemployment surge, what we should be considering, and then we'll go over to the next couple of entities. Julia, can you hear? Julia, are you still with us? Okay, she may have left. Oh, there you are. Julia?
She's there, but she must not have her microphone on. Julia, check your microphone. We can't hear you. We see your mouth moving.
We still can't hear you. We can see you're on mute now. Now you're unmuted, but we can't hear you. Okay, so maybe we'll just go. Elisa, do you have anything that you would like to share while we work out these technical issues with Julia?
Hi, good afternoon. Can everyone hear me?
Yes, we can hear you.
Okay. I don't have a whole lot, but I want to just point everyone to our DCF website for economic self-sufficiency, our public benefits policies and different waivers that have come through are all posted on that website. It's www.myflfamilies.com/COVID-19/access. And I will put that in the chat as well. But this week, the online purchasing pilot started statewide with Walmart and Amazon. Florida's SNAP recipients are able to purchase groceries online with the use of their EBT cards at those vendors. And that began as a pilot on the Panhandle and starting statewide April 21st. Other than that, I don't have anything new.
Okay, thank you. Julia, you want to try again? No, still nothing. So Julie Creefel, do you want to take a moment to share? We'll just continue to try to work through these technical issues in the meantime.
Sure. Hi, James. So just want to give you all a brief update. Many of the items that I talked about last week remain the same. We're working with United Farmers Alliance that we refer to as UFA. They're a group of Palm Beach County farmers. They're working on solutions to get product from the farms to the at-risk communities in Palm Beach County. I think I may have mentioned this in the prior call, but they started making some of their deliveries this week, starting small and working further and in greater capacity as we go forward. They are also working with Florida Department of Agriculture and Consumer Services, helping farmers get registered on myflorida.com so their products can be sold to the consumers. So we're very excited about that. They're a nonprofit. It's a collective of probably 30 to 40 farmers that are working together on this initiative. So they're getting product out of the field. They're keeping folks employed who are working in the field and the farmers' product moving. So that's a very exciting component of what we've been working on with hunger relief. The school district has changed their schedule a little bit going forward. You can visit their website to see the new schedule, or you can go to 211. Next week, they'll be still serving at their 35 sites. Their times have changed a little bit, and then they'll be serving 2 days a week next week. They're opening from 9 to 12, those are new times. And they're adding 16 new sites, and that will begin on April 30th. And you can check their website for that information as well. Then going into May, they'll be serving at 53 sites starting Thursday, May 7th, from 9 to 12. And again, folks can check their website for that. We're working on every week, we work with the pantries and the super pantries to identify what their needs are for food. We're working very closely with Palm Beach County and Palm Beach County Food Bank, as well as the pantries and other funders, to make sure they have particularly non-perishables that they need, and bridging those gaps from when there's mass distributions to what's being provided to pantries, and making sure that all of our at-risk community members are as served as well as possible with the non-perishable food particularly. We still have the sites at the additional sites to complement what the school district is doing. Flippany is out there with about 20 sites. Feeding South Florida has about 8. Boys and Girls Club have 8 sites. And I think, James, you mentioned at the beginning of the call that Palm Beach County opened 6 new sites. I believe most of them are at libraries locations. And they start serving, I believe, next week. So they sent out the press release yesterday, and we're very happy to have even more break spot sites for families. And we're finding that the numbers have almost doubled since we first started. They're serving now an average of 20,000 children a day, where they were serving 10,000. What else do I want to tell you? The seniors, right now, AAA, the Bowman Center, and DOS have been serving seniors with their home delivered meals. I've mentioned this on other calls, but this this week, just to underline, they just sent out a press release, which we shared with our network, that all the waitlist clients have come off the list and they're receiving food through the Aging Network. That's unprecedented. It's never happened before. So it's a very wonderful thing that the new and existing clients are receiving meals and that they're able to give the seniors what they need. They've also,
Yeah, it was a huge wait list too, so that's tremendous.
it really is. It is absolutely tremendous. And then they're also, I believe this is system-wide, but they added 500 new clients that have reached out and are receiving meals. And then on April 30th, the Area Agency on Aging is starting with their new food supplier, working with 2Js to do home delivered meals to, 5,600 home delivered meals. So they're going to be working through DOS and through the Bowman Center to accomplish that as well. So they're really getting out further and further to serve more seniors. So that's very gratifying to see that happen. One thing I didn't mention with the pantries, which I should have, is that we had, I'm just counting, sorry, 8 new pantries open this past week that had been closed. So I shouldn't say they're new, but they reopened. So we're really pleased about that. The ones that remain closed because they need the gloves and the PPE, the masks, and the sanitizing items. And also several of them are managed by seniors. So they want to make sure that everybody's safe with social distancing. But we're also working on getting them some of those materials, the gloves and the masks and the cleaning supplies, so that they can reopen.
And we're working on the PPE request as well. I do have to. Okay.
Can I just talk about one more thing? Elisa mentioned the online grocery purchase pilot program, which is great. It's 2 days in, as we know. And then lastly, what I wanted to mention in addition was the PEBT. I mentioned it last week. We're still waiting. We've heard through the grapevine it was approved and ready to go, but we still don't have that official word. So as soon as we do, we'll get that out too.
Okay, thank you. A lot going on in the food world. Thank you very much, Julie, for all you do and trying to, keep things together there. All right, Julia, can you hear us?
Hear me? I'm okay.
Yes, we can hear you now. Go ahead.
All right. Thank you so much for your patience. So it's all about jobs, and not a lot of people have them, and it's getting very sad out there. Everyone's looking for assistance. CareerSource has come to some relief. We've provided answers and calls to emails, and over 10,599 in the last month. We've helped people process their unemployment claims, not process them, but fill them out and answer questions. One of the things that I want to show you is a brand new chart from the state that actually shows you the claimants that are COVID-19 related. This is only for Palm Beach County, but you can see that Palm Beach County is number 4 behind Miami-Dade, Broward, Orange, and Palm Beach. So this metric gets updated every single day, and it also breaks it down by industries. So pretty good picture of what's happening in Palm Beach County. The next slide shows the brand new floridajobs.org website. Now, floridajobs.org is where you're going to get all your information, whether you're an individual applying for unemployment, whether you're an employer who needs assistance, and even for communities for providing access to block grant applications. This is the website that you go to for your information. So it coordinates all the state and federal partners' information. And if you clicked on individuals, we can go to the next slide. If you click on the individuals at the bottom of your screen, you'll have another picture that comes up. Now, they have changed the way they're doing things at the Department of Economic Opportunity. We know that they've had a surge in unemployment assistance applications. So anybody who is related to COVID, putting in a brand new application, brand new claimant, you have 24 hours, 7 days a week access to this website. If you're going back to look at your claim, or if you're an employer looking at claims, you have access from 8 in the morning till 7 at night. But over the nighttime, what they're doing is they are filing the paper claims. They're in the system, cleaning it up and making it better. So for the majority of people who've already placed their claims in the system, you can only go in between 8 in the morning and 7 in the evening. If you are filing as a new claimant, first time ever, then you can apply 24/7. Now, one of the things they did with this website, which has turned out to be really phenomenal if you go into it, is you'll see under reemployment assistance, there's several arrows. The first one is connect. Now, the connect part of it is the application. That's where people are having problems. But immediately under that arrow, if you go back one slide, James, I'm sorry. Good. As soon as you see that connect under reemployment assistance, the next one says reemployment assistance resource guide. I suggest everybody take time to read this because this is over 36 pages worth of questions and answers and FAQs related to how to apply. Any question you might have about your application, as the state gets these questions, they write the answers down and they put it in this guide, and they have been updating it. I have printed this out. It is a valuable resource for anybody who is going through the process. So please take a really good look at it. Now, the next two slides give you an example of what's in this reemployment, and I've picked out some questions that people want to know about. If I receive confirmation will I receive confirmation after my application is submitted and received? If so, how? And it breaks it down by the paper, by the online application, and then if you've submitted an online application through the Connect system, how will you know? How do I get a response? And then the next slide even is another sample of what is in the system. Actually, there's more in there related to the CARES Act. So do go back and take a look at all of these questions and answers. You will find your question somewhere in there. One of the things that they allow you to skip this year is not only the waiting period of the 1 week, but they let you employ Florida registration. I urge all of you that if you're going to be looking for a job later on, this is going to come back. So to get back into the system, one of the things that you can do in the meantime is to go into Employ Florida and make yourself a profile and start looking for jobs. We have hundreds of jobs available in Employ Florida. So take the time to actually go ahead and make yourself available in this application. So it's www.employflorida.com. And that is my update for this week.
Thank you. Thank you very much, Julian. We are out of time. I see we'll definitely get this PowerPoint to you guys. And I see also where some people put information into the chat box on different websites that are available, links that you can go to. Be sure to grab that. And if you can, copy it and paste it into your browser so you'll have that. We're going to go ahead and end this call because we're out of time, but I want to thank you for joining us again this week. Next week, we're going to have a poll. I wanted Doris to put it up this week, but we have to figure some things out to determine whether or not we want to do these calls every 2 weeks instead of every week. We know things are rapidly changing, but just want to see what you guys think about not having the calls every week, but every 2 weeks, whether or not you think that's a good idea or whether you think we should just continue to have it weekly. So with that, I just want to remind you to stay home, to stay safe, and we'll see you next week. Thanks.